Hi everyone, we are so excited to have you with us this week as we've now had more than 20,000 of you choose to subscribe to our channel and follow along our journey of trying to get pregnant, Sarah being pregnant, and now us being parents for the first time.
We are just so grateful that you all are here, and so for our 20K celebration, we are doing a Q&A, and we are answering some of the questions that you all left us in the comments on our YouTube community section. So thanks for those. There were some amazing questions, things we want to go into whole episodes on, so stay tuned for some of those. But for today, we are going to get through as many as we can in 20 minutes.
Yeah, and just in case this is your first time meeting us, I am Kurt. I'm a board-certified pediatrician and now a first-time dad.
I'm Sarah. I am a board-certified OBGYN and first-time mom.
And we are the Doctors Bjorkman.
Welcome back, everyone. This week is going to be all Q&A from the great questions that you all asked us in our comments section. Two quick disclaimers. The first is there were so many amazing questions that we could spend hours answering and would love to. But we aren't going to get to all of them. So if we didn't get to your question, we are so sorry. Stay tuned to our channel because we are going to try to cover a lot of the things that came up in the comments.
And then the second big disclaimer is, yes, we are both physicians in pediatrics and OBGYN, but we are not your physician or your child's physician. So if you have any specific medical questions, you should absolutely ask them to your own doctor, just to make sure that the answers that you get are specifically tailored to your situation. This is just for educational purposes and maybe a little entertainment along the way too.
Yeah. All right, to kick it off, the very first question that was asked was...
So what is the one thing you would do differently during your pregnancy journey if you had a redo?
And the answer to this one, honestly, is I would exercise more.
Yeah, me too.
We did a whole episode about this and about the importance and benefits of exercise in pregnancy. It's hard. You're really busy, your body hurts, there's a lot of barriers. My goal for my next pregnancy is to be better about exercising.
Gotcha. Okay.
The next question is, what is your best tip for preparing for labor and delivery? I'm so scared. Honestly, I think one of the best things you can do is do a lot of reading. Read pregnancy books. Talk to your friends about what to expect. Take a birth class. Do as much as you can to be informed about the process, because I think part of that fear is fear of the unknown. If you've never done it before, or you don't have friends who've had babies, you just have no idea what to expect. And I know when I know what to expect, whether it's a workout or going for a run or, I have to do a lot of anything. If I know what to expect, it's easier for me to process. So that's my advice.
Yeah, which I think segues well into the next question. Do you think you are more worried about your baby's health because you're doctors, or you're less worried because you can handle everything? And I think both for us caring for baby and for even during the pregnancy, I think it's a little bit of both, in that all of the things that can go wrong. And so there's definitely been moments where I tell Sarah we can't talk about something because I'm just have this angst and having seen kind of the worst end of the spectrum sometimes.
And that being said, there'd be things where I would say kind of doctor brain and mom brain disagreed. Mom brain kind of overrides your rational doctor brain, and something I would tell a patient, hey, this isn't a big deal, it's fine. Your mom brain and your heart just is so worried about these little things. So it depended on the situation.
Yeah, but there's definitely been times where baby's got a diaper rash, I know how to do this, let's take care of this and move on. So, okay.
Next question. What are ways to help increase your milk supply? Simply, the best way to increase your milk supply really is to empty your breast more. And this is a concept that was a little foreign to me. Empty breasts fill faster than full boobs. So if your breasts are full and you're not emptying frequently, basically it's telling your body, hey, we don't need milk as fast. Whereas if your boobs are empty and your baby's cluster feeding, those empty boobs say, hey, we need more milk, make more milk, make more milk. So number one, be emptying your breast frequently in those early days. It needs to be 8 to 12 plus times a day. When the baby is giving you hunger cues, let the baby eat, because that's really important for establishing your supply.
And I feel like the other big piece is just hydration, right?
And
like the
calories.
And calories. So like there was the first weekend I went back to work, and baby was home. Sarah was home alone with baby, and like she hadn't drinking all day, and like milk supply dropped, and just like, hey, drink water, eat calories,
food, empty your boobs.
Right.
Those are the main things to do.
Okay. Next question. As an experienced doctor working with moms and babies, was there anything that happened during your labor, delivery, immediate postpartum that was totally unexpected?
I had no idea how hard breastfeeding was. I mean, I said that, like, breastfeeding's hard, but some people have it easy. I struggled. It was really hard and really painful, and I was really surprised.
Yeah.
Yeah.
I think for me, the two things would be just like babies are a lot of work, and like you say that, and I've said that to many parents many times. But like just that you are never off, right? You've got 24 hours a day of an unreasonable human being that's just needy.
So cute.
And I think the other piece is just like how much love there is too, and the emotions that come with it. It's been actually really, really wonderful.
Yeah. So. To piggyback on the question regarding labor prep, are there any tips to prevent tearing during labor? So this is definitely going to be a whole episode, because there are some evidence-based things you can do. One of those evidence-based things is perineal massage, starting around 34 to 35 weeks. I will put a link in the comments that kind of shows an infographic of how to start doing this perineal massage or stretch. It is something we did. You will need your partner to help you. It makes sense in my mind if you had to do the splits in a month, you would probably stretch, right? You're going to stretch. You're going to try to practice doing the splits. You're going to do some gentle stretching. Kind of a similar concept. There is some data that it may help reduce tears. You can check out that link below and watch for the episode coming up where we go into all the evidence.
Okay, next question. Tips for couples who've been trying to conceive for a year plus.
A year plus. Go see an REI. Once you hit that 1 year mark of not conceiving, you should go see a fertility specialist. 90% of couples are usually pregnant within a year, and so when you get beyond that, you want to investigate if there is some other reason that you're not getting pregnant. So we do have a great video about tips for trying to conceive, which we can link here. But once you hit that year mark, please go see a specialist.
Okay. Cord blood banking and delayed cord clamping. Can you do both? So these are actually two different things
that we got a lot of
questions about.
Yep.
Yeah. So in terms of delayed cord clamping, this is something that's recommended by the American College of Obstetrics and Gynecology and the American Academy of Pediatrics, that if you wait 30 to 60 seconds after a baby is born, if they're full term, it helps decrease their risk of anemia and help increase babies' iron stores for the first couple of months of life. In babies who are preterm, it actually helps prevent or decrease the risk of some pretty significant things like anemia, need for blood transfusions, or some necrotizing enterocolitis, which is a very bad issue with the baby's gut. And so that's very good. Cord blood banking. So this is about like saving the baby's cord blood, which can have some special cells in it, some stem cells that can be used for stem cell transplant for certain cancers and other blood disorders.
And genetic conditions.
Things to know is that banking blood is very unlikely to help your baby. Could potentially help a baby sibling, but the best and most recommended way if you're going to cord blood bank is to use a public bank, so that then it can be actually used and can help other people with that, and that is an awesome thing to do if you're able to.
Private banking is really expensive. It's like $2,000+ I think to do the private banking.
And then a yearly maintenance fee.
There's a yearly maintenance fee, and again, as Kurt said, that they quote the chances of you actually ever needing that cord blood between 1 in 400 and 1 in 2,500. So the chances are really slim. It's very expensive, and if your kiddo has some genetic or hematologic malignancy type problem, they wouldn't be able to use their own stem cells because those cells have the same issue that kiddo had. So Yes, you can do both cord blood banking and delayed cord clamping. ACOG and AAP recommend delayed cord clamping for 30 to 60 seconds. ACOG and the AAP do not think there's enough evidence to recommend routine umbilical cord blood banking at this point.
Okay.
Next.
How did you guys meet? Can you share your love story?
Yes. So almost 10 years ago now, we met on our very first day of medical school at a picnic.
And we'd actually we met once in undergrad too. I gave Sarah my number and she didn't call me. But then 4 years later we met in med school.
Yes.
Started dating a couple months after.
Study dates.
Yep, study dates. Got married while in med school.
A year later, yep.
Yeah, which was awesome. And then did residency at the same institution. We couples matched for that. And then have done our subspecialty training at the same institution as well, which has been challenging but also wonderful to have someone who knows all the things we're going through along the way.
We love being married. We love each other. We like doing life together. We both think that it's been nice to be married to someone in medicine. It's like we're doing it together. Yeah. When we were in med school, we were studying the same things. We were getting ready for the same tests. We did our rotations together. So we just had a lot of shared experiences. Yeah. And when you're so busy, he was there at the hospital. During residency, he could bring me a coffee at night, because he was there, or we'd have lunch together, or just these other things.
She says coffee. I brought her ice cream at night. Yeah.
Yes. All right.
So, anyway, what do you got next?
That I have. I'm exclusively breastfeeding but have an oversupply. I'm constantly leaking through breast pads. I even put a pad in my bra and leak through that before baby feeds as well. What can I do to prevent leaking in between feeds but maintain enough milk for my baby? It's making me anxious to go out. I am so sorry. I have a picture of the first time I leaked through a shirt when I was out, and I was like, this is so glamorous, man, these babies. The answer here, instead of the pads, using pads, they sell these things on Amazon. They're breast milk collector shells. They're just basically these plastic collector cups. LV makes one when you can just put them in your bra and it'll collect that milk instead of soaking it into a pad, because that is liquid gold. Save all that you can. The other thing is to just have your baby eat, and that supply is going to regulate. It's very much a supply and demand thing. So if you are not asking more of your boobs, that milk is generally going to downregulate. Now, if you're pumping or doing other things, that can be asking your breast for more milk than you need. And so if you are having to pump, make sure you pump just to get the ounces that you need. So pump till you get 4 ounces and shut the pump off, and your boobs are going to regulate.
Okay, next. What kind of baby toys would you recommend for baby development? So this is a great question. We got the Love Every subscription, which we have really, really enjoyed for our baby girl. And it's been great in terms of those first couple of weeks and just how much she's loved the black and white images, which is really helpful with brain development and developing vision.
So for people who don't know what Love Every is, it's just this company. They sell a play gym. Some of this stuff is expensive. I think it's one of those great things to put on your registry because it is expensive. But they make this great play gym with lots of different toys, and then they have these subscription boxes that Kurt said, and basically every 2 months they send you a different box of age-appropriate toys. And what I thought was really neat about this is every box comes with instructions on how to play with your baby and how to use these toys. And so if you don't have a lot of childcare experience or haven't played with, how do you play with this tiny little infant potato who doesn't do anything? It gives you great ideas. It was really nice. It is kind of a splurge thing. Put it on your registry, ask for a gift. It's just been an easy, you don't have to think a lot about what to do.
Yeah, we were debating whether we should get one, and someone got it for us, and we are so thankful for it.
It's really fun. Yeah.
Okay. One of my postpartum nurses told me I had to make sure my baby didn't choke on his spit up when lying on his back. Naturally, this freaked me out. So this is a great question. So a couple of things to just kind of debrief with this. So the safest way for your baby to sleep is flat on their back.
Yep.
This has been shown to reduce the risk of sudden infant death syndrome. Second thing, so babies naturally have a reflex that's going to help them protect their airway should they have liquid or something in the back of their throat. And so this is like the way babies are designed to help them from kind of drowning in their spit.
Yep.
Having said that, absolutely babies can choke, and so this is why it's also good for those first couple weeks especially to have babies sleeping near you. This is why like a bedside bassinet can be so helpful in terms of making sure baby's safe while sleeping on their back in an empty crib or an empty bassinet.
Yep. I remember, that's a common question. I remember one of his buddies called him, had that exact situation.
It was their first night home. He's like, what happened?
She was
How do I
sleeping on her
sleep
back,
now?
choking. How do I ever go to sleep? So it happens. It's scary.
But then like the baby is protecting themselves, and you are there as parents to just help support them, a couple back pats, and
Yep.
they are amazing how they bounce back.
Yes. All right. What are the most effective ways to develop a child's intelligence and brain development?
Yeah, so this is another great question. So the best thing you can do is read to them, talk to them, interact with them, right? So like their ability to grow and develop depends on them being loved, cared for, and then them hearing words all day long is the best way to help their minds learn language and work on development.
Just by talking as you go about your day is going to expose that little kiddo to more than 2,000 words. So just talk to them. Tell them what you're doing. I'm turning on the faucet. I am making oatmeal. It feels dumb, but it's really great for their brain development.
Okay, next, what are your opinions on elective induction at 39 weeks and the ARRIVE study?
Ooh, great question. I am actually a big fan. My elective induction was scheduled for 39 weeks and 3 days.
Baby came 2 days before
Yeah,
that?
it came a little earlier, but this was a big study, randomized controlled trial, so a really good type of study that was done in 2018 that basically looked at first-time moms having an induction versus going into labor on their own. And what the study found was that moms who were induced at 39 weeks, assuming they didn't have other complications going on, actually ended up having a reduced risk of having a C-section. They had a reduced risk of some of the hypertensive disorders of pregnancy. And there was a reduced risk of neonatal respiratory support needed. So there are certainly some benefits. It's a great study. It's something to talk to your doctor about if you are interested in it.
Okay, awesome. Okay, next. In the first month or two, should there be any type of schedule such as eat, play, sleep? Also, how do you get them to sleep in their bassinet when they just want to sleep on you?
Oh, I remember when Cease just would not sleep anywhere else.
Anywhere. Yeah. Lots of like holding babies.
Schedule. So yes, there are some really good things to think about just in terms of routine, even for little tiny babies. You want to separate eating and sleeping if you can. It's really hard when they're little, but you got to keep them awake to eat.
Yeah, I think some good rules of thumb, like in those first few weeks especially, is like baby needs to eat often.
Yep.
And then like realizing that like the eat, play, sleep routine is kind of natural, and babies have these natural wake windows. So in those first few weeks of life, you shouldn't really expect your baby to be awake for much more than 60 minutes at a crack, which is like they're going to eat, they're going to play for a little bit.
And they eat for 20 to 30 minutes.
And then they need to go back to sleep.
Right.
And so trying to push them past that, you're just really kind of hurting yourself with that. I think another good rule of thumb is like trying to work to get them to learn day early on and exposing them to bright lights during daytime, and then making sure that the nighttime feeds are kind of brief and boring and things are kept dim so that they learn the difference. I know that was 2 weeks of baby not knowing the difference, and so that's a good way to kind of work through that.
And by the time they're 6-8 weeks old, that whole eat, play, sleep paradigm is a great kind of thing to work on and follow.
Yeah, and a great resource for you guys that was just game-changing for us too was Taking Care of Babies. We will put that in the description as well as a resource, and something that was a great video series that we used to help us kind of think about this thing.
And we did a great sleep video for YouTube that kind of put all of our thoughts and merging of resources that we use that we can link here that hopefully is helpful to you guys too, and is totally free. Okay, next question. Do you feel like the experience of bearing a child and giving birth will change the way you practice medicine and your bedside manner? And if so, in what ways? What was it like being a patient instead of the physician in this situation?
Gotcha. So are we different doctors because we've done this?
Yeah.
I would say the first thing is like the medicine doesn't change. I don't feel like my ability to be a physician like depends on having lived through something, right? And so like the advice and the medical advice is still the same.
Yep.
I think maybe the question like does it change bedside manner? I think I definitely have a whole lot more respect for how much work caring for a newborn is.
Yeah.
That then like makes me a little bit more understanding of like making recommendations about adding a medication that's 3 times a day or 4 times a day, and how much that might affect someone's life.
Yeah, definitely. And I think that I kind of echo that I think I always worked really hard to connect with patients and try to understand what was going on. I do think it is a great privilege that I have this experience to build on, to again be able to connect with patients and understand what they're going through. I feel like my pregnancy counseling is very much the same. I feel like how hard postpartum is definitely has changed, because it's really hard. In terms of being a patient instead of the provider, it's hard to, I had a care team that I really trusted, and so that really helped me to be able to not be the one in control, and so that was really important.
Absolutely. Okay, next.
Ooh, my wife is having bad nausea and is throwing up frequently and wants to know, is it worth it?
Yeah, absolutely.
Yes.
It is so hard, but it is absolutely worth it.
It is, and throwing up is the worst. If you checked out our video on morning sickness, maybe some of those things can help. I hate throwing up.
Yeah.
It's worth it. I promise.
I have to say, like, me saying it's worth it, being the person who had no symptoms, because I, of course, wasn't carrying the baby, but, like...
It's worth it.
The
Hang in there.
Worth it. Yeah.
Hang in there. Favorite nursing bra. It's this, my favorite one is this cheapy, it's off Amazon. It's called the Lupinette, I think. It's in our Amazon store. However, it has like no support. So if you're someone who is bigger chested, it's not the bra for you. Anything Auden brand from Target, they have a great, so comfy, like padded nursing bra that has the pads sewn in. It's super comfy. It's super easy. Love that one. I think I have one from Kindred Bravely that's fine. My favorite's the cheapie.
Okay. Next, what month is best to start introducing baby to solids and water? So in terms of like baby feeding, so breast milk or formula only for the first few months.
First few? What's the first few?
First few, yeah. So solids, like generally babies are ready to start that transitioning to learning just how to make a food ball that they can swallow between 4 and 6 months. And then in terms of like liquids that aren't breast milk or formula, like things like water should really be reserved until baby is at least 6 months of age, and this is just because their kidneys are still relatively immature and are developing, and too much water can kind of throw off the electrolyte balances, and so just something to be careful with in babies who are still in the first 6 months of life.
And this is one of those times that I am very thankful I am married to a pediatrician, because I have no idea. That is one of like figuring out how to introduce solids is one of those things I'm just starting to research, so looking forward to sharing that with you. I think we want to try baby-led weaning or something like that, so more episodes to come.
What are your newborn must-haves?
Ooh.
So I think we need to do an episode on this too, but if we had to pick 2 things, I think we'd say the swaddle, which has been life-changing for sleep.
And a baby wrap. To wrap her in, to be able to carry around and have her on you and have your hands free.
Which goes back to the baby who wouldn't sleep anywhere but on you.
Yep.
Okay.
What do you eat in a day or anything to help breast milk supply? Kind of touched on this earlier. Just eat a well-balanced diet with enough calories. Your supply can be really sensitive to eating enough calories and drinking enough water.
Yeah. Our daily routine has now become that like I get up and like I get baby, change diaper, baby goes to mom, and I go make oatmeal.
Yes, there is some thought that oatmeal maybe helps your supply, so I hate oatmeal, but I've started eating oatmeal for the baby.
She likes it with lots of brown sugar now.
Yeah. Okay, can you talk about spit ups? My newborn spits up a lot. Welcome to the club. This is new to me as my first child didn't spit up a lot. Thank you.
So babies spit up a lot. As you mentioned, if in your own experience, not all babies spit up, but if you think about it, there's a small muscle that sits on top of the stomach that's job is to allow food into the stomach and then not allow it back. In babies, that muscle's pretty immature, so it's both short and thin. As they grow and develop over the first 6 to 12 months of life, that muscle gets thicker and longer, which means it's better at keeping food in the stomach. Some babies spit up a lot. It's normal. There is a spectrum. As long as they are gaining weight, it is not an issue usually. It's a laundry problem, not a medical health problem.
We go through so many spit rags I just constant.
Yeah.
All right, next question. OBGYNs versus midwives. I'd love to have both, but I don't want there to be a power struggle. Do you ever deliver alongside midwives or doulas? Best practices for managing your birthing team. Absolutely, we deliver alongside midwives and with doulas, and it, as you said, it's a team, and everybody has some different skills that they bring to the table. Where I trained, the midwife, if you wanted a midwife to provide most of your care, that was awesome, and they did that. And usually the midwife will call the OBGYN like when the baby's about to be born, just so that the OBGYN is in the room if there's some emergency or something like that. The midwife's there to catch the baby, the OBGYN's there just kind of for the birthday party, and if you have a doula, awesome. The more the merrier, as I say that as restrictions are being lifted with COVID kind of restrictions, but absolutely can do both. Midwives are awesome.
Yeah, and actually I think a lot of your colleagues chose to do midwife care for the birth, and then knowing that they had great OBGYN backups if something went wrong, which is pretty cool.
Yeah.
Okay, what's next?
Ooh, preparing for C-section and aftercare.
Yeah, so we got a ton of questions about C-sections, so our next episode is going to be all about C-sections. I have been
writing it this week and coming up for you ASAP.
Next, so would you please share your tricks and tips for dealing with the witching hours? Do you want to start with this?
That 4 p.m. to bedtime when the baby just cries and is not happy.
Yeah.
Distract. What do? So we sing, we go for walks to the mailbox, we walk around and do tours of the house, we look at the faucet, we open the refrigerator, we try to play in her play jam, and when that doesn't make her happy, we go do something else. Kurt takes a turn. We have a bath.
Changing environments has been absolutely key. So today it was, hey, we're going to go look at the light and kitchen appliances, and then we're going to walk outside, and then we're going to take a bath, and then we're going to walk outside again. And so distract, and then until we get to that time, okay, it's bedtime now, this is your schedule. And so also having a schedule has helped us even for our sanity, say hey, this is what she usually does. We know when to expect her to be extra fussy, and then getting a routine has helped us work through those. Okay, next question. Considering how hot it's been getting, ways to keep baby cool. So we actually had a couple other questions about, what should I dress my baby in, etc. A good rule of thumb is kind of whatever you're wearing plus 1 layer for sleep is generally about right. So for us, baby's been in a sleeper and then a swaddle blanket for most sleep. In terms of keeping cool on hot days, I think also what you're wearing is probably about okay if you're warm. Another big thing is keeping baby in the shade and making sure they're drinking and staying hydrated. Baby should have 0 sun exposure for the first 6 months of life, and that is because their skin is very sensitive, and also they really shouldn't be using sunscreen for the first 6 months of life either. Okay. And then finally, we got a handful of questions about just how are we doing with our time, with our careers, how is baby? And so
somebody asked when is a good time to have a baby if you're a doctor or whenever. The answer to that one is there is never really a good time. There are times that are not as bad as the rest.
Yeah, and we've had colleagues do that at all stages of training, whether it's in med school, in residency, in subspecialty training, in attending life. We chose pretty specifically to wait, right? We've been married for over 9 years and decided...
9 years in December is our anniversary.
Right, it feels like an eternity. But we waited, right, because we wanted to say, like, we wanted to have a little bit more control over our schedules, which is what we finally have now, and it's been a good time for us, and so that's worked well. Kind of as we've both gone back to work now, realizing, gosh, it's a lot of work with the baby, and trying to balance that. We've been fortunate to have family who are able to help us out. But definitely, like, hats go out to all the working parents, we think.
It's tough.
Yeah.
But it's great.
And baby is doing great also.
Oh yeah, she's
it is
so adorable.
Amazing how fast she's growing and developing. She is no longer a potato.
And we're watching her on the baby monitor. We wanted her to make a guest appearance, but her
It's after
bedtime
bedtime.
is 7 p.m. So we're going to put a little video in of her at the end because she's so stinky cute.
So, but I think that's going to be it for us this week.
Yeah. Again, sorry if we didn't get to all the questions. There were so many. They were so good.
Yeah, this
We'd be
video
here
was
all
so
night.
long already.
So long already. Hope you enjoyed. We will definitely do this again. So keep those questions coming.
Yeah.
And we will see you next week.
Bye, guys.
Bye.
What you doing, baby Cease? What you doing? Oh, hi. Hi, baby Cease.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.